Hello, I am Carol Bashford, Associate Professor in the Department of Nursing. I have earned a master's degree in nursing and a PhD in gerontology. Before I talk about quality management in healthcare, I will describe my experiences with quality management. Before joining the team at Miami University, I had a progressive career as a licensed registered nurse, RN, in a few hospitals. As a staff RN, in addition to managing the health of our patients, we supported the quality management process in conducting quality monitoring audits and root cause analysis. As a clinical nurse specialist, I participated in the Nursing Executive Council for evaluation of our quality management plan and data and other committees supporting quality management. Now, as a faculty member, we conduct quality management for our Department of Nursing and participate in the university's quality management activities. The purpose of quality management in healthcare is to ensure the delivery of high quality and high value care. Healthcare is a complex system. High quality care interventions are based on national standards, professional discipline standards, and current research studies. The Institute of Medicine defines healthcare quality as the degree to which healthcare services for individuals and populations increase the likelihood of desired health outcomes and are consistent with current professional knowledge. That's according to the AHRQ website. Healthcare is provided in several locations: hospitals, clinics, medical offices, outpatient specialty centers, long-term care centers, as examples. Healthcare delivery is a very complex system consisting of a large number of complex care delivery processes. Numerous categories of licensed professionals, non-licensed personnel, and the information documentation system that is called the electronic medical record. First, let's explore what is meant by healthcare delivery in a hospital setting, the most complex of all healthcare settings. There are numerous care management processes involving a variety of professional licensed personnel, such as physicians, nurse practitioners, nurses, physical therapists, respiratory therapists, and others, along with non-licensed personnel, such as the person who draws blood samples for tests, X-ray technicians, and patient care assistants. Everyone contributes different aspects of patient care. Hospitals use integrated, interdisciplinary, and interdepartmental processes for every aspect of healthcare delivery. When a person enters the hospital seeking health interventions, the process of admission initiates healthcare services as well as integration of the electronic medical record. The admission is individualized to the health situation. For example, a person can be admitted as a patient with an emergency situation through the emergency department, or for diagnostic tests as therapists or therapies in the outpatient services areas, or for a scheduled surgery in the surgical area, or as a transfer from another facility. There are also processes related to specific medications or interventions that need more intense monitoring. There's a patient care coordination and continuity of care processes, and a discharge planning process to coach the patient how to plan for care management after leaving the hospital. In accordance with health insurance company standards and national guidelines, patients can be admitted into the hospital for the management of a serious health condition. Once the appropriate treatment plan is established and the patient's health status is safe, then the patient is released to their home or a community-based care center to continue this treatment plan to achieve total recovery, that is, their optimal health status. The utilization review process is a daily comparison of the patient's health needs to care standards and the patient's insurance company's criteria for being able to be in the hospital as an inpatient for inpatient care, to determine justification for continued hospital care or indicators for discharge. These criteria are linked to reimbursement to the hospital by the insurance agencies. In addition, hospitals have processes to address the various safety domains such as infection control, medication management, advanced life support, and others. For patient care, there are processes to ensure availability of resources, supplies, and equipment maintenance. Hospitals also use processes to assure information security, that is, the medical record control processes, so that professionals can review test results and communicate for patient care. Another is building utility security processes, such as the national safety standard that only authorized personnel access patient care supply areas. Financial implications. For hospitals, effective quality management and compliance to national standards of care is a key criteria in order to achieve reimbursement from Medicare, Medicaid, and other health insurance companies. Recently, Medicare and Medicaid have implemented a policy imposing financial penalties to hospitals related to deviation from standards, such as core measures and others. For example, a patient who is rehospitalized related to the same problem they just recently been left the hospital for and are rehospitalized within a short period of time is considered a deviation. Evidence of high-quality care processes is regularly evaluated by external regulatory organizations such as a Joint Commission and other certifying agencies conducting on-site visual surveys of processes. Challenges to implementing quality management in healthcare are numerous. Challenges relate to the complexity of processes, the numerous variety of processes, the availability of reliable, standardized quality management tools, the variety of stakeholders, the vast number of healthcare providers and personnel involved. Another challenge can be how patient perspectives can influence quality management data. For example, if a patient is a smoker, they are not permitted to smoke in the hospital. Thus, they could report a low patient satisfaction score on a patient survey because they are distressed by not being able to smoke while they were in the hospital. This concludes my discussion about quality management in healthcare. Have a great day.